That's all you have to know. It's an indirect thrombin inhibitor. Okay, let's dive in. Now, main thing we will look at is the differences between heparin and warfarin. As an introduction, let's just look at a difference between heparin and warfarin. Heparin, warfarin. Okay. Now, what and all you know already, that you say. It's parenteral, right? It's parenteral. Warfarin is oral anticoagulant, right? Oral anticoagulant. This one is a parenteral anticoagulant, right? This is a, warfarin is a coumarin derivative. Heparin is a mucopolysaccharide. Heparin can be used in vivo and in vitro. Warfarin is in vitro. Okay. What else you need to know? Warfarin is synthetic. Warfarin is synthetic. Heparin is from pig intestine. Heparin is natural. It's natural. It can come from hog lung or pig intestine. Okay, so let's put this as a natural green thing. Then, how does warfarin act? It inhibits synthesis of clotting factors. Inhibits synthesis of clotting factors. Right? It inhibits the synthesis of clotting factors. What does heparin do? Heparin blocks action of factor 10 and thrombin. Okay. We will go through the coagulation cascade, then you will understand. The synthesis of clotting factors are reduced in warfarin. Heparin, the factors are present and it is blocking their action. Right? This much did you understand? Now, if there is a heparin overdose and you want to undo its action, you can give an antagonist to heparin, that is protamine sulfate will be an antidote for heparin. For warfarin, you can give vitamin K as the antidote. Fine. Then what else will you monitor? When you are giving heparin, you should monitor APTT, clotting time. You have to monitor. For warfarin, you have to monitor prothrombin time and INR. Do you know what these are? This is essential. You have to monitor. Okay. APTT means what? Activated partial thromboplastin time. And for warfarin, you have to monitor prothrombin time or INR, that is international normalized ratio. If it is below 1.1, then it is normal. Okay. Please note that warfarin can have variable response. It is going to have many drug interactions. Hence, you have to keep an eye on this prothrombin time. It is very important to monitor a person who is on warfarin. Drug interactions are huge, are significant, you can say. For warfarin, the drug interactions are significant and you usually use it for maintenance. Warfarin is used for maintenance. However, heparin is used for initiating therapy. Okay. Is this much clear? So, what and all we saw in this video? We saw the classification of anticoagulants. You have in vivo, you have parenteral and oral anticoagulants. Under parenteral, you have indirect thrombin inhibitors and direct thrombin inhibitors. Under indirect thrombin inhibitors, you have heparin and low molecular weight heparin. They are indirect thrombin inhibitors. Under oral anticoagulants, you have coumarin derivative, that is warfarin sodium. The other classifications are indandione derivative, factor 10A inhibitor and oral direct thrombin inhibitor, which we will learn in further videos. Mainly what they have asked for you in the exam are heparin and warfarin sodium. So you should know these two. Warfarin sodium is oral, that's why we have put a tablet here for you. And heparin is also important. They've given the differences between heparin and warfarin in this table. Warfarin is an oral anticoagulant as mentioned already. It's an oral anticoagulant. It's a coumarin derivative. It can be used in vitro. However, heparin can be used in vivo and in vitro. Warfarin is a synthetic product and heparin is natural. Warfarin inhibits the synthesis itself of clotting factors. In heparin, the clotting factors are present and it is blocking their action. It is an indirect thrombin inhibitor. You can write that here. Indirect thrombin inhibitor, right? The antagonists are protamine sulfate for heparin. For heparin, the antagonist is protamine sulfate. For warfarin, the antagonist is vitamin K. Prothrombin time you have to monitor, very essential. INR or prothrombin time you have to monitor for warfarin because warfarin has variable response. It also has drug interactions which are very significant. Hence, warfarin is given only as a maintenance dose. For initiating therapy, you can use heparin. Okay. In the next video, let us continue with understand. Just one more thing I wanted to tell you for heparin warfarin differences. See, warfarin is what it is doing. It is inhibiting the synthesis of clotting factors, if you remember, right? So what will happen? Some clotting factors will already exist. So what will happen? It will take time to set in. So there is a delayed action. 1 to 3 days it will take to set in. But once it sets in, it will act for 3 to 6 days again. But the thing with heparin is it blocks the action of the existing clotting factors. Hence, it will do immediate action. And the thing is, it will act only for a few hours. But that's why they say for initiating therapy, they will use heparin. And for maintenance therapy, you will use warfarin. Okay. Just remember, warfarin, it is very essential to monitor because it has a very variable response. Okay.